Hi class, in this chapter we'll be discussing the gram-negative bacilli of medical importance. So all of the organisms that will be discussed in this chapter, they are all gram-negative. None of them are gram-positive. Here's a breakdown of the recording. So this recording will include the intro. We'll talk about Pseudomonas infections and some of the zoonotic bacteria. The second recording will discuss Bordetella and pertussis, which is whooping cough, and Legionella. The third recording will discuss the Enterobacteriaceae, which includes things like E. coli and Shigella. And then the fourth and the last recording discusses the Yersinia and the plague, along with Haemophilus infections. Okay, so here's an intro about the aerobic gram-negative bacilli. So these are a very large and diverse group of bacteria. None of them are spore-forming, so they are non-spore-forming bacteria. They are found in a range of habitats, so we'll see that some of them are found in water. Others are found in the large intestines. Others are found in other animals, so they're considered zoonotic infections. We're going to be discussing the ones that are medically important, which means there are tons of them that are not of any medical significance. What they all have in common is that they all have this outer membrane like lipopolysaccharide in the cell wall. And if you guys remember, that's considered the endotoxin and can lead to a septic shock. So we'll see that a lot of these diseases are quite severe, okay, and when compared to some of the gram-positive infections. So examples of these infections, and again, we're going to talk about, a lot of these in more detail. For example, Pseudomonas, it is considered an opportunistic infection. So we'll see that most of these Pseudomonas infections are considered hospital-acquired infections, meaning that the patients will get it either from a healthcare setting or a hospital setting. They tend to lead to surgical wound infections or catheters, infections of the catheters leading to UTIs. Another infection are Brucella and Francisella. These are both zoonotic pathogens. Bordetella and Legionella are, along with the Yersinia and Haemophilus, are considered human pathogens. True human pathogens, meaning that we don't have those as part of our normal microbiome. And then the Enterobacteriaceae, these are diseases of the enteric system, hence the name entero, because we'll see that some of them are found normally within the colon as part of our human microbiome. Now, first one, the Pseudomonas or the Pseudomonads, these are small gram-negative rods with a single polar flagellum. They are found, their main habitat is soil, seawater, and freshwater, so mainly water. And they are important, especially the ones in the soil, they are considered to be important decomposers. They all are oxidase, when it comes to Pseudomonas, they're oxidase and catalase positive, meaning that they are aerobic bacteria. Now, the one that we'll discuss is Pseudomonas aeruginosa. So, aeruginosa comes from the fact that it leads to this silverish, grayish, bluish color, especially when there's an infection of a skin infection due to a burn or a surgical incision. And we'll take a look at that when we get to the image of that. So aeruginosa means silver. Okay. Now the common habitat of Pseudomonas aeruginosa is soil and water, and frequent sources of infection. Like I said, most of the time, these are considered opportunistic infections where we acquire the infection in a hospital setting or a healthcare setting, either due to contaminated ventilators, contaminated anesthesia equipment, contaminated IV solutions, contamination of a catheter. Here you can see where the aeruginosa name came from. So here there are infections of the skin. And you can see this like kind of grayish, bluish, reddish color that is very characteristic for a Pseudomonas aeruginosa infection. Like I said, it's a very common cause of nosocomial infections, usually in patients that have burns. It can lead to pneumonia in patients with cystic fibrosis. It could also lead to infections in patients with neoplastic disease, so they have cancer. And and again, that's why it's considered an opportunistic infection. So usually, if a patient isn't immunocompromised or they don't have other medical conditions, Pseudomonas doesn't really cause a disease, but it will take advantage of a hospitalized patient with burns, cystic fibrosis, or cancer, and will lead to some of these diseases. So we saw the skin infection. It can also lead to pneumonia. Um, it can sometimes spread, leading to bacteremia and endocarditis. And again, what is very characteristic is this very greenish blue pigment and a grape like odor. So let's make sure we're all good here. So, what is the main reservoir for Pseudomonas aeruginosa? Is it soil and water, infected individuals, asymptomatic carriers, or wild animals? So I'll give you a moment to think about it. And if you answered soil and water, then you are correct. Okay, again, though that is the main reservoir, the main place where we get those infections from. Now, the next infections to talk about are zoonotic infections. Zoonotic infections means that again they are transmitted from infected animals to us humans. Now, these are very tiny gram-negative cocobacilli. Cocobacillus is a rod shape that is a little bit of a sphere, so it kind of looks more like oval shaped as opposed to a rod. And so we'll talk first about brucella. Brucella infection leads to a disease called brucellosis. Brucellosis has several names. Okay, all of these are names for it. So it's also called Malta fever because it originated in, or at least it was first discovered in an island called Malta. Malta is a tiny island that is found in the Mediterranean Sea. It is found south of Italy. It is also called the undulant fever because of how the fever comes and goes. So there's this fluctuation of fever where the patient is feverish and then normal, and then it goes back to having a fever and so on. Okay, hence the name undulant fever. It is also called Bang disease, but we don't call it Bang disease in humans. It's called Bang disease in animals. Okay, so when animals are infected with brucella, they get the term Bang disease, but us humans get the terms either brucellosis, Malta fever, or undulant fever. And one of the best ways to prevent a brucella infection in humans is to vaccinate animals. So, since they are the source of the infection, there is an animal vaccine that's available. So we could also, kind of routinely check on animals if any of them are infected. They are quarantined. We need to pasteurize milk because we'll see that one of the sources would be the cow udders that could infect milk, and then we drink that milk and then we get infected. Now, brucella is also considered a potential biological weapon, and there are some reasons why that is and why it's not really used as that. So, the reason or the advantages, I guess, I don't want to say advantages, but the reason why it could be considered a potential biological weapon is that it's easily transferred from animals to humans through airborne. Okay, so meaning that it it could be transmitted pretty easily And at the same time, it's pretty hard to detect the source of the infection. At first, the disease causes these very vague symptoms, and again, kind of making it hard to diagnose. And it tends to be a chronic disease, so this disease could potentially affect a person for over a long period of time. Now, the cons against using it as a biological weapon is that it has a pretty long incubation period and it has a low mortality rate, which is, you know, a positive thing. And it's also, if it's diagnosed or when it's diagnosed properly, there is treatment for it. Okay. Um, so these are the things you want to keep in mind on, you know, the use or the potential use of brucella as a biological weapon. And it's I mention it because it's well, first it's in your textbook. Plus, you guys are the ones who are going to be protecting us in the future from these potential weapons. Um, Another thing that I wanted to mention about brucellosis is that the which animals are sources of infection. Okay, so it's not really in the book, but you do get asked about it several times. Is that the main source of infection are sheep, cattle, goats, pigs, dogs, horses. And that is why we'll see that people who deal with these animals are the ones who tend to get infected. For example, farmers, those in slaughterhouses, veterinarians, again, when they have these very vague symptoms of a fever that comes and goes, you kind of want to check and see maybe they have brucellosis. Now, the next zoonotic infection is Francisella. Francisella tularensis leads to a disease called tularemia. It is a disease that is endemic to the northern hemisphere, and us humans tend to get it from rabbits. Okay, hence the other name is called rabbit fever. It's transmitted by contact with infected animals, infected water, dust, or even bites by ticks, flies, and mosquitoes. So, again, it's kind of hard to track down what the source of the infection is. We'll see that those who handle rabbits or those who handle the source of infection are the ones that are mostly contract this disease. So hunters, animal trappers, again veterinarians, those who have jobs related to wildlife. Again, you want to look for these very vague symptoms like headache, backaches, fever, chills, muscle weakness. What really helps are these skin lesions, especially if they were bit by a mosquito or a tick. It gives this very characteristic hard lesion at the site of the bite. Now, other signs and symptoms, like I said, the skin lesions are pretty characteristic. You have this little hard ulcer. The lymph nodes that drain that area will be enlarged. Sometimes the conjunctiva of the eye are also red and inflamed. They could have a sore throat. So it kind of seems like these very random signs and symptoms, but when you put them all together, it kind of directs you towards tularemia. And again, that's why we need to ask what people do for a living, what their hobbies are, because they could be hunting as a hobby. And again, that little piece of information could help direct you towards the correct diagnosis. It is a very treatable disease once it's diagnosed. The death rate is pretty low, and that only happens when there is systemic involvement, especially if it gets to the lungs. But again, early diagnosis could be treated with a little bit of antibiotics. Unfortunately, there's no vaccine available against tularemia, and again, it is considered a potential bioterrorism agent. Again, the whys, that's basically the same answers or the same reasons that we have discussed when we talked about brucellosis. And that ends part one.